So this is R.A.T.S for UG undergraduates. Please be very careful about the topics that you are going to choose and read. And we all know that R.A.T.S means racing against time for students. The hypersensitivity reactions are a little abstract and then more difficult to follow or reproduce. But it is worth its weight in gold. Look at the number of subjects that are being covered under this topic. Pathology, microbiology, pharmacology, medicine, anesthesia, surgery, and whatnot. They can be UG as well as PG questions. And the different format of questions are given over here. As usual, think of the subheadings. The subheadings will take you to the answer. Always make a list of it and then follow this list very scrupulously. It can end up even in a problem-based learning. Just a cartoon to highlight allergy. All of us are allergic in the morning. That's why we don't get up. Definitions are definitions. Individuals who have been previously exposed to an antigen manifest reactions during the subsequent exposure. That is the definition of a hypersensitivity. Antigen and antibody, it is beyond the scope of today's class. And it is so very annoying that this man cries, please manifest my allergies into a human form so that I can physically punch him on the face. A nice quote. What is the significance of this hypersensitivity? You find that there is an excessive or a harmful exposure to a specific antigen. Antigen means it is a protein that is inducing antibody formation. An immune response or a protective mechanism or response becomes abnormal. It is over and above, exaggerated and harmful. And this is called as hypersensitivity. This might result in tissue damage or even death. However, it manifests in specific individuals. And also, it will be manifested only after a second or subsequent exposure to the offending agent, not at the first exposure. So these are certain important parameters which we shall bear in mind as an introduction to hypersensitivity. Now, look at this particular table very carefully. It is called Coombs and Gel Classification of Hypersensitivity Reactions. This table gives us the type of reaction, the type of hypersensitivity, what it is mediated by, the onset, and some examples. So, the first one, type 1, is mediated by IgE. The antibody is IgE antibody. It can occur within minutes or at the most an hour, and it is called as anaphylaxis. Type 2 is non-IgE mediated. It can be IgM, IgG, or membrane attack complex, MAC. It is cytotoxic and it can occur from hours to days. The classical example is a hemolytic anemia. Type 3 again is non-IgE mediated. Here it is IgG or complement or neutrophils that promote. It is an immune complex disease and this is the duration, slightly delayed. The classical example being a vasculitis or a serum sickness. Type 4, again a non-IgE. So it is promoted by the T cells. It is cell mediated. It can take days to weeks. The best example is your tuberculosis or the tuberculin test itself. So these are the other examples. Please by heart this particular column. It can be applied for any of the hypersensitivity reactions as an introduction. As a continuation of the class, I shall be starting with type 1 hypersensitivity. A case history, as usual. A 50-year-old villager came to the dermatology OP with rashes all over his body. On taking the history, he was found to have taken some medication the previous day. The HOD of dermatology warned him severely and gave him a written note about the drug. The note was to be preserved with him. Discuss the pathogenesis of this disorder. Now look at this one. This is the kind of eruption that the patient was having throughout his body. Thanks to LME for the photograph. This was an actual instance which I witnessed as an undergraduate student. And this was the advice that the professor had given. He asked the patient to mention the word sulfur, sulfur repeatedly. The patient was allergic to sulfur and he should never ever take the drug again in his life. What is the definition? It is a tissue reaction that occurs within minutes of the injection or inhalation of an antigen to which IgE antibody is already present on the surface of the cell. So during the first exposure, it is produced, and at the second exposure, you find it is already present and a chain of reactions are to follow. Now, what is the mechanism of type 1 hypersensitivity? It will appear very complex. Just follow what I say. It is an immediate reaction mediated by IgE, immunoglobulin E. It is anaphylactic or allergic in nature. The allergens will induce or activate the B cells, which will produce plasma cells. These will liberate IgE antibodies. Subsequently, you find that there can be cross-linking of the antibodies, degranulation, and a release of a number of mediators which will cause the reaction. Please by heart what I have said, word to word. If it is very difficult, the entire detail is given in the text tips. Even otherwise, look at this picture, a beautiful picture from labpedia. Thanks to them. Antigen, there is an antigen producing cell which activates the B lymphocyte. This is getting transformed into the plasma cell, an ovoid cell with eccentric nucleus. The plasma cell produces antibodies. The antibodies get attached to the basophils or the mast cells on the surface. This is the first step. Hope I am very clear. So, what happens in this one? It is basically a reaction in which the antigen induces a reaction within minutes because of the antibody that is already present on the surface of the mast cell. The steps are, there is some education or sensitization. Previously, the patient is already exposed to it. That means the cells are educated. They are sensitized. Small quantities of them will suffice later. Later on, you need not have a large volume of the drug or pollen. A very small quantity is sufficient to trigger the reaction. Sometimes the exposure might have been in the early childhood, but later on, the cells have got a very long memory and a very long life. Therefore, the reaction can occur even in an adulthood. It can be local or systemic. It can be fatal. Local or systemic, or sometimes it can be fatal. Please do remember this. So these are some of the examples. Asthma, conjunctivitis, rhinitis, very common to us. Anaphylaxis or shock, angioedema, urticaria, rashes, penicillin allergy. This box we shall be memorizing. Now look at these details. We have already mentioned that in the previous slide. We will not be repeating it. But then I would like you people to kindly understand the types of hypersensitivity. Type 1. It can be local and severe. For example, a localized hypersensitivity, hay fever or a rhinitis, bronchial asthma, limited to the lungs or the respiratory system, atopic dermatitis or contact dermatitis, or it can be systemic and fatal. Classical example is penicillin injection, horse tetanus anti-CF. So this particular list, I think we'll be able to retain. This is how things happen. This is a very beautiful diagram. I would like you people to kindly understand. So there is an allergen. It can be any form. And it is exposed to a cell. And because of this, you find that the peptide is being produced. This is called an antigen presenting cell. It presents the details to the TH cell, and then this stimulates the B cell. B cell is a lymphocyte. And you find that there will be some antibodies over there. There will be some receptors. The B cell later on gets matured into the plasma cell, which produces a lot of these antibodies. The antibodies get attached to the surface of the mast cell or the basophils. Look at the blue granules, blue for B, basophils. The mast cell is the tissue counterpart of the basophil. So I find that all the antibodies, all the Y-shaped structures are getting stuck to the surface receptors of these cells. On a re-exposure, already there are two antibodies over here. So you find that there is a pollen that is getting again entering the respiratory system. So you find that it gets attached to both these receptors, as a result of which there is a slight contraction, and therefore it activates the cellular cytoskeleton. They all contract, there is a rupture of the cell. And this particular cell will be containing, particularly the mast cell, will be containing histamines, leukotrienes, and other mediators. And it will be havoc. So please be remembering this. Allergen, antigen presenting cell, the B cell, activation of the plasma cell, production of antibodies, attachment to the basophils, and two antibodies are present. There is a cross-linking of the antibodies, contraction, and then degranulation. So these steps, I think you people will be able to rattle off very easily. So this is what I had explained previously, just for your recapitulation. And the courtesy is labpedia, of course, it goes there. This is a mast cell. This is a basophil. Basophil is found in the blood and the bone marrow. Mast cell is found in the tissues. The mast cell is supposed to be a tissue counterpart of the basophil. Both these cells will be having the receptors. This crescent-shaped structures are called the receptors for IgE, Fc receptor. This is what I had shown earlier. And look at this one, the receptor, the antibody is getting attached to it. Again, antibodies are attached. When the antigen gets linked to this, you find that there is a slight contraction, as a result of which there is an activation of the cytoskeleton, which gets contracted, the cell ruptures. This is called mast cell degranulation. You can call it as bridging or cross-linking of the antibodies. This particular diagram, I would like you people to draw. Very simple, very important, and you can easily draw it. Now, what are the systemic manifestations of type 1 hypersensitivity? It can be a systemic anaphylaxis. It can be life-threatening, either in the blood or the lung, dyspnea, hypotension, smooth muscle contraction, a spasm of the muscles, bronchiolar constriction, again because of muscular spasm, increased amount of mucus secretion, suffocation, and bronchospasm. All of this will be as though the patient is in water. And these are some of the things that you people can see during the clinical examination. Hives means this kind of rashes. Wheezing will be present over here. There will be a difficulty in breathing or swallowing. Swelling, and in fact, we call it a laryngospasm. If no intubation is done, the patient can die immediately. Anaphylaxis, hypotension. This is a beautiful example and a slide which I would like you people to follow, a continuation of the same. This is a localized type of hypersensitivity 1, the bronchial asthma. This by itself is a question. I need not tell you the importance of bronchial asthma. See what is happening over here. First is sensitization. So this is the pollen over here, and this is the mucosa. You find that the allergen is getting deposited, and it activates the T cells, the B cells, and from that you find antibodies are produced by the plasma cells. The mast cell is there. It undergoes a degranulation. Sometimes you find there can be a recruitment of the eosinophils also. So either the mast cell or the eosinophils will produce a number of mediators which we shall be seeing. So this is number 1. This is a very important simple diagram which you can make use of for your systemic pathology as well, and also for a question in medicine or pediatrics. It is a continuation of the same. I find that on subsequent exposure, first time you find that there is a pollen, but once the mast cell is there, there can be a cross-link. Look at the number of antibodies that are there on the surface now. And when there is an antigen that is again entering it, you find there is a cross-linking or bridging of the antigens. So antibodies. So there is a contraction, there will be a degranulation. Because of the degranulation, a lot of substances can be released. This can lead to, look at this, this is a blood vessel from which material is seeping out. There can be a vasodilatation. There can be an edema. The muscle, it gets contracted. There can be a muscular spasm. Also, the eosinophils can get degranulated. So this is what is happening. Because of all this, you find a lot of this mucus substance is being produced. It coats. The patient is unable to breathe. And at the same time, there is a constriction. You can imagine the plight of the patient. He has to be saved immediately. That is bronchial asthma. Explain this well. Parasite immobilization. If you people write this in the exam, you get an additional mark. This is a repetition of a diagram from Robbins, but this is a thematic and a wonderful, simple diagram which you people can draw. During all this, chemical mediators means it is not restricted to the first chapter. You find it will be haunting us throughout, whether it is bronchial asthma, whether it is anaphylaxis, whether it is shock, etc. There is something called as ECF, eosinophilic chemotactic factor. Therefore, the eosinophils come into play. That is why you find eosinophilia in a case of parasitic infestation. This is a diagrammatic picture of a parasite, very nicely drawn. And you find that similarly, there will be receptors on the surface of the eosinophils. And these are the antibodies. The parasite itself happens to be the antigen. There are the antibodies. They get attached to the receptors, and the same old story of degranulation. And C3b is also a kind of receptor which is over there, which promotes opsonization. This is a eosinophil, normal brick red granules, and the bilobe nucleus, just given for the idea of it. So these are the things that you people will have to remember. And if you go back to tips, it is given in a nutshell. You people will have to sit and memorize. Of course, the diagrams and the flow diagrams that I had given are of paramount importance. Please do remember and draw them. Big changes with small steps. So these are small short notes which I am completing. To be continued.